Hello, my name is Omar. I'll be your student news for today. I'm going to start by performing hand hygiene for 20 seconds. So, can I get your name and date of birth? May Jones, March 1st, 1990. Go ahead and confirm this. Everything seems to match. So the doctor has ordered for me to put in a urinary catheter. Have you had this procedure done before? You have not? Okay, I'll go ahead and explain it. So you have been having trouble recently urinating, so the catheter will assist you with urinating. And how it'll work is there's a catheter, which is a small plastic tube that will go inside your urethra and be held into your bladder, okay? And from there, we're going to go ahead and after 2 to 3 days, see how we're going to remove the catheter, and we're going to see how you're urinating from there. Most of the time, patients are usually fine and they are able to urinate normally after removing the catheter. So you might feel some discomfort while I put in the catheter inside the urethra. Just let me know if you feel any pain, comfort, or have any questions throughout this procedure. Do you have any questions right now? No questions? Do you have any pain at the moment? No pain. Do you have any allergies? No allergies. But do you have any discomfort regarding not being able to go to the bathroom right now? You do? I'll go ahead and make sure to write that down. I see that your general physical condition seems to be good. You just have some discomfort. So I'm going to go ahead and hand hygiene, clean gloves, clean my area for 30 seconds. Okay. It's been 30 seconds. I'm going to go ahead and let the table air dry for 2 minutes. Remove my gloves, perform hand hygiene. The door is closed, the curtains are pulled, you are in a supine position. I'll wash my hands. I'm going to go ahead and put on a pair of clean gloves so that now I could go ahead and get you in the preferred position. I'm going to clean the peritoneal area and I'm going to give you a blanket as well, okay? Just so you don't get cold. Okay, so I put on my gloves. I'm going to go ahead and expose the area here. And are you able to externally rotate your thighs outwards, so like in a frog-like position, just like this? Okay, thank you very much. All right, I'm able to give you your warm blanket, and I have here a chucks that I'll place underneath you. Okay, and I have a towel that is soaked in water and soap, and I have 4 flaps, each flap for a clean area or a new area to clean. So I'll get the left side first, then I'm going to go over the right side. Now we'll go straight down the middle, and then the last flap will be used to go straight down the middle as well. Okay, now I'll use my clean, dry towel to go ahead and pat dry. All right, I'm going to go ahead and provide you your privacy. Okay, so now that I've went ahead and cleaned the area, I'm going to remove these gloves, perform hand hygiene, and bring my materials. I have my CHG pad, stabilizer, and 10 ml syringe. And I have my Foley catheter kit here. Okay. I'm going to use my 1-inch border that I'm allowed to use right here. Okay, I'm going to go ahead and remove my sterile gloves. I'll be using that in a moment. I'm going to drop in my supplies, my 10 ml syringe, my stabilizer, and the alcohol pad here. Sorry, the CHG pad. should be good. There we go. All right, put that on. Now I'm going to go ahead and expose the area so that I can go ahead, perform hand hygiene, put on my sterile gloves. Okay, and the packaging here for the sterile gloves, I'll make sure it does not touch the sterile field that I have set up. All right, now I'm going to go ahead and don on my sterile gloves. So I've got on my okay. I'm going to go ahead and slide my fingers underneath. And I'm going to go ahead and don on my left hand now. Okay, now I'm going to go ahead and rearrange and just make sure everything's in the right position. Making sure not to break sterile by touching the unsterile part. Okay. Okay, so I got my sterile gloves on. Now I'm going to go ahead and put on my sterile drape. I'll go ahead and move these to the side. Okay. Make sure that the shiny side is facing down, and we'll place it onto the patient. Okay, perfect. Now I'm going to go ahead and rearrange my contents. I have my alcohol swab sticks, lube, and syringe with sterile water. I'm going to go ahead and dispose of this. Now I'd like to remove my specimen cup out of the way, and I'm going to go ahead and remove the lube. Dispose of that. Go ahead and put that back down there. And now I'm going to remove the sheath that I have for the catheter that I have here. So we're going to go ahead and remove it. Okay, I'm going to go ahead and remove this sheath. And now I'm going to go ahead and put in the tip of the catheter inside the lube. Okay, now I'm going to go ahead and place that into the box. And now I'm going to put in my syringe with sterile water into the port. Place that back inside the box. And lastly, I'm going to go ahead and put in my my alcohol swab sticks and transfer this on next to the patient. Alright, Ms. Jones. So if you have any pain or discomfort throughout the rest of this procedure, just let me know, okay? So what I have is I have alcohol swab sticks. I'm going to go ahead and retract the labia, and I'm going to go ahead and clean the meatus. And afterwards, I'm going to count to 3, and on 3, I want you to go ahead and exhale. And when you exhale, I'll put in the catheter, okay? Alright, so I'm going to go ahead and now expose retract the labia. Now I'm going to go ahead and, like I said, count to 3, and I'm going to go put in the catheter in the urethra, okay? Alright, so I'm going to count 1, 2, and 3. Exhale. Very good. And now I'm going to see urine, so I'm going to go 2 more inches. Okay. Now I'm going to go ahead and stabilize the catheter. Use my left hand to inflate the balloon. Alright, now I'm going to pull back, and I do feel resistance. Very good. So Ms. Jones, are you in any pain right now? No pain? Are you tolerating this procedure well? You are? Alright. Now I'm going to go ahead and get my CHG wipe so that I can swipe the area for 5 seconds. 1, 2, 3, 4, and 5. And I'm going to go ahead and dispose of that. And now I'm going to put on the port so that I could extract my specimen. So we're going to go ahead and extract a minimum of 5 mLs. Alright. And I'm able to get 10 mLs of urine. If I was not able to get the 5 mLs, I'll go ahead and kink the tubing so that I'll be able to get the a minimum of 5 mLs. However, I was able to get 10 mLs of urine here, so there was no need to kink the tubing, okay? Alright, Ms. Jones, so now what I'm going to do is I'm going to go ahead and remove these gloves, perform hand hygiene, and I'm going to go ahead and put on a pair of new gloves. So Ms. Jones, are you tolerating this procedure well? You doing okay? Alright. So I've cleaned my hands, or performed hand hygiene. Putting on my clean gloves so that I could put on my stabilizer now. Okay, I put on my clean gloves, so now I'm going to go ahead and remove these contents here. Bring my stabilizer. Alright, and then it's clicked onto place. So now I'm going to go ahead and make sure that this adheres to the anterior upper thigh area. Okay, and I'm going to make sure that the catheter is underneath the bladder and is attached to the bed here. Okay. Alright, so now I'm going to go ahead and clean the area. So Ms. Jones, are you in any pain right now? Okay, is the catheter feel any discomfort? No discomfort? Okay. So now I'm going to go ahead and what I'll do is I'm going to put on the specimen. Sorry, I'm going to go ahead and get my urine specimen and make sure that it is placed into the specimen cup, okay? So what I'll do is I'll go ahead and remove these gloves. Put on a pair of clean gloves. Or before I do that, I'll remove my gloves, perform hand hygiene. And then I'm going to go ahead and put on some clean gloves now. Alright, Ms. Jones, almost done with this procedure. I'm going to go ahead and provide you your privacy. I forgot about that, sorry. I would have put on the patient's blanket on after I took out, or after I put on the catheter. Okay. Let me go ahead and open my specimen port. What I'll document is the patient's name, today's date, time of the procedure, and the MRN. Go ahead and clean the rest here. Alright, Ms. Jones, I'm going to remove my gloves, perform hand hygiene. So I'm going to document today's date, the time, how the patient tolerated the procedure, size of the catheter, and the amount. Hello, my name is Omar. I'll be your student nurse for today. I'm going to go ahead and start by performing hand hygiene. So can I get your name and date of birth? May Jones, March 1st, 1990. I'm going to go ahead and confirm this by checking your armband. And I see here that everything matches very well. So the doctor has ordered for me to remove your Foley catheter. Have you had this procedure done before? You have? Okay, I'll go ahead and, you have not? Sorry, I'll go ahead and explain it to you. So what I'll be doing is, a couple days back, there was a Foley catheter inserted inside your bladder and held in your bladder by sterile water, because they inflated the catheter with sterile water into a balloon so it can be held in place, which allowed you to urinate more easily. Okay. So what I'll do today is I'm going to remove that balloon by deflating the balloon and taking out the sterile water. And if there's no resistance and everything goes smoothly, I'll just go ahead and take out the catheter, and that should conclude with the procedure. And I'll go ahead and provide additional education after I remove the catheter. Any questions or concerns for now? None? Do you have any allergies? No allergies. Do you have any pain? No pain. And do you have any questions or concerns? No questions or concerns? Okay, I'm going to go ahead and begin by performing hand hygiene. What I'll do first is I'll gather my supplies. I have my chucks here, my 10 ml syringe. So what I'll do is I'll close the door. I'll provide privacy by pulling the curtain as well. And I'm going to go ahead and perform hand hygiene. Put on a pair of clean gloves. And do you have any questions or concerns just to make sure? None? You understand the procedure? All right. All right, and I make sure that you are in a supine position. I'm going to go ahead and retract or remove the blanket. And are you able to externally rotate your thighs in a frog-like position? Thank you. Okay, so now what I'll do is I'm going to go ahead and place a chuck here. And make sure this. Alright, I've got the chucks on, and now I'm going to go ahead and remove these gloves. Perform hand hygiene. Put on clean gloves. Alright, and now that I've got my clean gloves, what I'll do is I'm going to make sure to remove the 10 mLs of sterile water here, okay? Alright. I'm going to go ahead and dispose of this here, and I did get my 10 mLs. Alright, so now what I'm going to do is we're going to go ahead and provide instructions. So I want you to take a deep breath on when I count to 3, and I want you to, we're going to essentially blow out. And when you're blowing out air, I'm going to go ahead and remove the catheter, okay? You might feel some discomfort or not. However, it should be relatively painless, okay? Alright, so 1, 2, 3. Go ahead and blow out. Okay. And what I'm going to do now is I have it attached to the Foley, and with this Foley, I'm going to go with the bag that has urine inside of it. What I'm going to do is I'm going to take it to the bathroom, and I'm going to empty the urine inside of the Foley, okay? And I'm going to go ahead and empty into the graduated cylinder so I can know the amount of the urine, okay? All right. All right, so now what I'll do is I'm going to go ahead and then after I get the urine into the graduated cylinder, I'll go ahead and put the Foley and the catheter in the proper receptacle. Now I remove my gloves. I'm going to go ahead and perform hand hygiene. And now what I'll do is I'm going to provide some education. So for the next 1 to 2 times that you void, I want you to go ahead and call me so that I'm able to get the amount of urine that you're voiding, okay? And you might feel some stinging or burning for the next couple times that you urinate. However, subsequently, as you go ahead and urinate, the pain of stinging or burning should be lessened, okay? If you're bleeding while urinating, if you're having excruciating pain or increased pain, or you're not able to urinate, go ahead and let us know, and we'll make sure to deal with it appropriately, okay? So if there was resistance while removing the catheter, what I would have done is I would have attached the syringe one more time so that I could remove more water. However, there was no resistance while removing the catheter, and if I did remove more water and there was still resistance, what I would do is I would not pull or tug forcefully, and I'll just call the provider. Okay. All right. So, do you have any questions or concerns? And did you have any pain throughout this procedure when removing the catheter? I should have asked the patient if they had pain after I removed the catheter. Okay, I would do that in the normal setting. So you mentioned that you had no pain and you tolerated the procedure well. So what I'm going to go ahead and do is ask, do you have any questions or concerns? No questions or concerns? All right. So what I'll document today is I'm going to document today's date, the time, how the patient tolerated the procedure, the amount and description of the urine in the Foley bag, as well as the amount and description of urine for the next 1 to 2 voids. I'm going to give you your call it. I'm going to lower your bed. And anything else I can assist you with? Nothing? All right. Thank you.